Yes, thank you very much. Well, thank you, Martin. Well, my name is Harold, so I'm from Utrecht University in the Netherlands, and as we don't have anything in place like the Vet GDP, I would like to start this presentation with my own personal story. Exactly 20 years ago, I graduated as a veterinarian and received my diploma at Utrecht University. And at the time, I was, of course, well aware of the fact that I did not have all the knowledge and skills to practice unsupervised yet, but as the saying was back then, the only way to become a real veterinarian is to gain experience under supervision in the authentic clinical workplace. Well, according to my diploma, of course, I was fully qualified, so at the local practice where I was working, I was promptly promoted to running a local branch of the practice, and if it had not been for the highly experienced veterinary nurse who assisted me and frequently helped me out, I would not have survived. In the Netherlands, we are currently facing several serious challenges related to early careers in veterinary primary care. To begin with, a recent large-scale survey by the Dutch Association for Veterinary Medicine revealed that early career veterinarians in salaried positions are at the highest risk when it comes to well-being. Research from Duin et al. Showed that new graduates often still feel insufficiently competent at the time of graduation to independently perform relatively simple and common clinical tasks. Think of working up a patient with gastrointestinal complaints or interpreting blood results. In addition, an excellent study by Danse Zonneveld, who also is present here today, demonstrated that there is often a mismatch between the expectations of young veterinarians and their employers, particularly regarding guidance and support. And several other studies have shown that the attrition rate among veterinarians in the first 5 years after graduation is significantly higher than among general practitioners in human medicine. Roughly 1 in 6 veterinarians who leave practice compared with 1 in 20 GPs. And moreover, those who leave almost always do so within the first 5 years after graduation. Those who make it through that phase generally remain in practice. And as a consequence, veterinary shortages further contribute to increased occupational stress and well-being. But why is this happening? How come veterinarians in the Netherlands are affected more negatively than other health professions? Well, the veterinary profession has evolved rapidly over the past 25 years, and in addition to their work for animal health and welfare, veterinarians are increasingly playing an important role in interdisciplinary societal issues, from animal health to public health and from animal welfare to the climate and the environment. The amount of available knowledge is growing exponentially, and technological advances are following each other up at high speed, currently accelerated by the rapid rise of artificial intelligence. Patient owners and farmers are more demanding than ever before, and at the same time we are dealing with a new generation of students who set different demands on work-life balance and personal development. So more and more keeps being added, while little can be removed. And that leads to the inconvenient truth that the current 6 years of our undergraduate program in the Netherlands maybe is insufficient to cover everything that is needed for unsupervised and fully licensed practice. Well, the gap between education and independent practice has become too large to bridge for our graduates. And this comes with significant cost for society. For example, costs associated with the DVM program, graduated vets who leave practice after a few years. economic losses due to workforce shortages, but also the cost accompanied with hiring new personnel, and healthcare costs related to people who face well-being and or mental issues. And especially in these times of limited public resources in the Netherlands, it is essential to invest effectively and efficiently in veterinary education, and therefore a more structural solution is also needed in the Netherlands. Well, what can we learn from other Dutch health professions? In veterinary medicine, we still train students for 6 years to obtain full licensure to treat at least 7 species, while the newly graduated veterinarian is almost simultaneously expected to function as an anesthesiologist, a radiologist, and a pharmacist. By contrast, in human medicine in the Netherlands, it was already recognized in the 1960s that the 6-year program for just 1 species, of course, the human, was insufficient. And in 1973, general practice was officially designated as a medical specialty. And ever since, completion of a dedicated postgraduate training program has been required for registration as a licensed GP. And all other healthcare professionals in the Netherlands follow a similar trajectory, a foundational degree followed by several years of postgraduate training before being allowed to practice unsupervised. Well, therefore, I advocate the creation of a formal postgraduate program in primary care veterinary medicine in the Netherlands to follow the 6-year undergraduate program. This would be a 2-year trajectory, and that can be shorter if the learning objectives are achieved sooner. In this model, the veterinarian in training would primarily work in a certified primary care veterinary practice, and alongside their clinical duties, the program would include regular training days with other veterinarians in training, focusing on deepening knowledge and engaging in peer reflection, drawing on cases from their own practice. In this way, a network of newly graduated veterinarians can emerge who are learning, reflecting, and developing together. And step by step, similar like the Vet GDP program, the veterinarian in training can grow toward independence and full competence in the core and relevant professional activities of the fully licensed primary care veterinarian. Similar developments are also seen internationally with the Veterinary Graduate Development Program Linda just gave a presentation about. And, well, this new continuum, including a postgraduate program, also aligns very well with Utrecht University's updated educational vision. And in this vision, Utrecht University emphasizes the importance of a solid disciplinary and interdisciplinary foundation, active engagement with societal challenges, and space for individual development. The underlying framework is built around 3 interrelated educational domains to which all our programs should contribute, namely qualification, socialization, and subjectification. Qualification concerns the knowledge and skills essential to the veterinary profession. Socialization involves learning to function within a tradition, norms, and values of the professional community. And that takes time, especially in a profession as deeply rooted in tradition as veterinary medicine. And finally, subjectification. That refers to personal development, the formation of a professional identity, centered on questions such as, how do I relate to society and to my profession? What do I want to learn? Why do I want to learn it? And who do I want to become as a veterinarian? And by establishing a mandatory postgraduate program, we can create a space and time for residents to work on learning goals related not only on qualifications, but also, and maybe even more importantly, on socialization and subjectification. So, to conclude this presentation, investing in a redesigned veterinary educational continuum with the introduction of a mandatory postgraduate program for primary care practice in the Netherlands could help us to bridge the gap between the veterinary school and clinical practice, lower attrition rates in the first 5 years after graduation, help to improve employability and long-term employability, improve the quality of veterinary care, a better remuneration also for early career veterinarians, and help to reduce work-related stress and workload, and finally, more effective and efficient use of both public and private funds. Well, as the literature shows, in the Netherlands, most likely we are not the only country facing these challenges, and that's why also VetGDP was introduced. So let's collaborate, and for this purpose I would like to start and establish an international special interest group, and have to look with Linda how to relay that to the RCVS, for postgraduate training in primary care veterinary medicine. Let's share ideas, best practices, and try to learn from each other. So if you're interested to collaborate, please send me an email, and then I will get in touch. Okay, thank you very much.
Thank you very much, Harold. I'm sure there'll be questions after that grand vision.
Hi, I'm Vicky. I'm the research manager at RCVS. We're publishing our exit survey data on Wednesday. That's tomorrow. So I was really interested to hear you talk about vets leaving practice. Is it your impression that those vets leaving clinical practice are leaving veterinary altogether, or are they moving into non-clinical roles, do you think?
Yeah, that's a good question. There is some research about it, and it's a mixed picture actually. The majority of the vets that are leaving clinical practice in the early 5 years, they are going to other roles still within the profession. But there's not much research about what the reasons were why they leave clinical practice. And if it was a positive choice to go for another role within the veterinary profession, or if it was because that they didn't like clinical practice. So I'm not really sure about that. Yes.
Goes on to yours. So I think you're absolutely right with that question, because we do need those vets that leave clinical practice. I'm actually one of them. We need those people that leave clinical practice and they actually elevate the status of the veterinarian in society, in a different way than clinicians do. And so that might actually be quite a key piece of information to get a hold of, to really understand, is this a problem, or are we feeding, veterinarians to parts of society that also need them, beyond clinical practice? So thank you for that comment. Yeah. Very interesting.
Thanks, Harold. I obviously agree completely with your sentiment. I was wondering what the reaction has been in the Netherlands to putting forward this idea, although it might just be the start of the conversation there. Have you? Yeah. Is there a motivation to do the same?
Yeah, good question. We started the conversation, I think, 3 months ago with my inaugural lecture at Utrecht University, and what we see is that there's a broad support for the idea, but the most difficult thing is, and that also relates to the plenary session of Professor Norsini, is the implementation. How to start. There are a lot of legal issues. So that's also why I would like to learn from well, how you've organized this within the United Kingdom, and how we could deal with all those challenges. But there is a broad support for the idea, both with employers, with newly graduate vets. So yes.
Thank you. Any further questions for Harold, or we can welcome questions for any of the session speakers? We have a few minutes left before lunch at 12:30.